So, what are the pros and cons of keeping the cervix in a partial hysterectomy? Hello, I'm Dr. Taiwo Durawade from Data Gynecology, here to answer a follow-up question to my partial hysterectomy video. All right, so what are the pros? One pro is that you preserve sexual function. Some patients after a total hysterectomy complain that they have to get adjusted to being sexually active again, that it feels different. And that's because the vagina was interrupted. In a partial hysterectomy, where we leave the cervix behind, the vagina is not interrupted, and those patients don't have that adjustment period. The second pro is that the risk of cuff dehiscence is basically non-existent. Cuff dehiscence is when, once we take out the uterus and cervix, we sew up the vagina. And so sometimes those stitches come apart. It can be caused by multiple different things. Now, granted, the risk of that happening is rare, but it's still a risk of having a total hysterectomy. But in a partial hysterectomy, that risk is completely non-existent because we don't interrupt the vagina at all. Now, let's talk about the cons. One con is that you might still have spotting every month. So the cervix is part of the uterus. The cervix also has a cavity. If you're around the age where you're still ovulating every month and you're releasing estrogen, that cervical cavity is going to respond to estrogen and bleed every month. So it's not going to be heavy bleeding, but it might be spotting, but it'll happen like you were having your period every month. So that's one con of leaving the cervix behind. Another con of leaving the cervix behind is that you'll need a pap smear regularly. When we take the uterus and cervix, you don't need to get pap tests anymore. Now, you still need an annual every year, but we don't need to collect a pap test at your annual. The pap is done at the cervix. So if you leave the cervix behind, you still need a pap smear regularly. And if for some reason the pap is abnormal or something comes up abnormal on the pap, you might need additional surgery to get that cervix taken out. Now, as I said in my previous video, the risk of prolapse for both partial and total is the same. In a hysterectomy, we're cutting the ligaments to get the uterus out. So whether or not we leave the cervix behind or we take the cervix, we're still cutting those ligaments. And so the pelvic floor can weaken and either the cervix can fall out of the vagina or the vaginal tissue itself can fall out of the vagina. Now, if you're having hysterectomy for endometriosis, it is recommended to get a total hysterectomy, meaning take the uterus and cervix. Evidence has shown that some women keep having pain because the cervix is part of the uterus. It can still transmit endometriosis pain. So if it's for endometriosis, it's recommended to do a total. I hope you found this helpful. If you haven't followed me yet, follow me now. Share this video with someone. And if you're in the Chicagoland area, you're looking for a gynecologist, come and see me. Call or text 708-340-1167. I'll see you soon.